Thank you so much for being here with us on this beautiful day in Surrey. I'm Anita Huberman. I'm President and CEO of the Surrey Board of Trade. And I'd like to acknowledge that we are on the traditional and unceded territory of our Coast Salish peoples, specifically the Kwantlen-Katzie, Semiahmoo, Tawasin First Nations, Kaycut-Coquitlam, and of course, our Inuit and Métis peoples. They have a profound connection to the land and water that surrounds our great city of Surrey. We've invited you here today at the Surrey Board of Trade to really harness a very critical and heartbreaking message from an economic and workforce lens. We need to remove the politics from healthcare decisions, and our report that we are releasing today is calling on the BC government to focus on Surrey's healthcare services, to invest in our workforce. Ladies and gentlemen, Surrey is going to be the largest city in British Columbia very soon. Our report from the Surrey Board of Trade, called Surrey's Hospital Needs, says services are severely insufficient. Residents cannot be treated within our city's borders for the three leading causes of death that are heart attack, stroke, and trauma. In addition to necessary specialty pediatric services, we have the greatest number of children, babies that are born within British Columbia, and we do not have specialty pediatric services within our city. They have to be treated north of our bridge in Vancouver at the Royal Columbian Hospital. Patients requiring treatment must travel over a bridge to other hospitals to receive care. This is a matter of life and death, everyone. The Fraser Health Authority recognizes Surrey Memorial Hospital as a regional hospital. However, it does not have the facilities and services required to treat specialty pediatric services, heart attacks, strokes, and trauma. These patients must be transported to other hospitals across a bridge. Unfortunately, if there is a natural disaster, snow, an earthquake, preventing access across that bridge, there is no hospital in Surrey or in the South Fraser Economic Region that can treat heart attacks, strokes, pediatric specialty care, or certain types of trauma. From the Surrey Board of Trade's perspective, this is unacceptable for our workforce and residents. As the BC government considers investments in healthcare, especially as the BC budget is being released next week on February 28th, they must provide funding for both Surrey Memorial Hospital and the new Surrey Hospital that is being built to ensure that there are enough maternity beds, emergency room beds, pediatric beds, and that there is the ability for healthcare professionals to treat heart attack, stroke, and trauma. As it stands, there is no emergency plan that addresses how residents living south of the Fraser will access life-saving services in the event of a natural disaster. We agree and welcome the BC government's investment in Surrey, but there needs to be more consideration, more focus to our city. We're going to be the largest city in British Columbia very soon. We're growing by 1,200 to 1,400 people a month. We're the highest intake city of newcomers, and especially with the federal government's immigration targets of 500,000 newcomers a year, Surrey is going to be the beneficiary of those newcomers. The hospitals south of the Fraser need to have the necessary investments to keep up with our population growth. We have a current health crisis in Surrey, and healthcare, our workplace, our economy are linked together. The workforce is the engine that drives the economy and supports the financial underpinnings of our healthcare system. So we're calling on the BC government to refocus, reshift our services and infrastructure that we need here in Surrey. And that is our message to BC's Minister of Health, Adrian Dix, and our Premier, David Eby. And now I welcome your questions. Thank you very much, everyone. Any questions? We're going to be handing out the report shortly. It's been pre-sent to media yesterday, and we will be following up with the provincial government as well. There's a lot of work to do, and of course in collaboration with our healthcare colleagues, some of whom are in the room.
So what would you like to, what bottom line do you think Surrey needs? I mean, there is a new hospital that's being built. What would you like to see here?
Well, for both the existing hospital and the new hospital, we want a commitment to have those services that will treat for heart attack surgeries, trauma, specialty pediatric services. Yes, there's a state-of-the-art cancer care clinic that is going to be built at the new hospital, but we need those services and the workforce that will support it to be here in Surrey. And this is especially personally heartbreaking for me because I had someone very close to me that had a heart attack last year, and she had to be transferred from Surrey Hospital to Royal Columbian to have her surgery done. And yes, the care that she received was amazing at both hospitals, but it was a matter of life and death. And why should someone that lives in Surrey be transported across a bridge to receive a heart attack surgery? So we want to see those services right here in our city. We deserve that here in Surrey.
I just had a quick scan of the numbers, and so it looked like on a sort of a per capita basis, Vancouver received significantly more funding than Surrey. Can you talk a bit about that?
Yes, so, Canada, Surrey falls well below the national average of the number of beds that we need per 1,000 people. So Vancouver in itself receives more per capita than we do for healthcare. And so we know in a comparative between the Fraser Health Authority funding and the Vancouver Coastal Health Authority that Fraser Health receives just over $2,200 per person. Vancouver Coastal receives just over $3,000 per person. And I know my healthcare colleagues at the Hospital Foundation can exemplify and articulate the actual specifics as it relates to Surrey. Fraser Health Authority is a large health authority that doesn't only include Surrey, but the disparity is certainly there in terms of the services, the number of beds that are a comparative between Surrey and Vancouver, despite our growing population. We have sent a letter. We've put in a request. This is not a new ask. We have actually spoken to the minister in the past about these services through an event that we had during the pandemic. But the minister has said to us that with different research that his ministry is engaged in, that his research shows that it is cancer care, it is those technology pieces that are currently planned for the new hospital is what the research shows that Surrey residents, South Fraser residents need. But what we are hearing from our physician community is that there is not enough services to treat the core services to treat heart attacks, trauma, specialty care for our children. We need those services as well within our city. So it's not a new ask, and we'll be engaging with the minister and the premier when he comes to Surrey on Friday next week. Any other questions? All right, well, thank you so much, everyone. Really appreciate you being here. And I ask all of you to read the report, social media it out, And we're all in this together to focus on needed investments for Surrey's healthcare industry. Thank you so much.